Welcome to the X Dr. Tommy O Show. The X Dr. Tommy O Show takes a comprehensive, holistic approach to our community's concerns. Before we get started, I'd like to, as always, thank Bishop Dr. Timothy Burkett and Church Alive Community Church for giving me this opportunity to enrich your lives through this TV program. Today we have a special show. This is going to be the final segment of a three-part series called Operation Safe Child. Today I have a special guest who's an expert in this area. She's a pediatrician from the Bronx. We'll discuss this and I will introduce her in a moment. But before we go into the introductions and the topic of the show, I'd like to go over some announcements. First, the first announcement is on Sunday, June 18th. Happy Father's Day. And that was also my birthday, so now I'm 42. The second, Church Alive Community Church with Bishop Dr. Timothy Burkett is holding a church day, July 22nd, on 2006 at Joyce Kilmore Park, and that's located 161st Street across the Supreme Court steps right down the street from Yankee Stadium. The third is Church of Obedience with Pastor Butler on July 8th, 2006. She'll be holding an outreach located on Brook and 138th Street and thereabouts. So look on your calendar, mark it, be there. Get involved, make a difference. My final, I would like to hold a memorial for a patient of mine. Unfortunately, she passed away. Her name is Megli Mino. On June 8, 2006, she passed away. So I'd like to have a moment of silence. I'd like to offer my condolences and God bless Erica, Blanca, and the Mino family. Before we get into today's show, I'd like to summarize the past two parts, Operation Child Safety Part 1 and Part 2. A few months ago, I gave a presentation on child safety here at the church, and again, I'd like to thank Bishop Burkett for allowing us to do the show here. All three parts were filmed in God's house, the house that God built, which is Bishop Burkett's house. During this presentation, apparently I touched a lot of people, and a lot of people came to me and wanted to know more about child safety and child abuse. So I sat down with Bishop Burkett and we decided to do a three-part series. The first part was about child safety and a child ID, an identification that you can have and hold. So in the case that there was an emergency, that you would have this card available that you can present to the police, and they'd be able to track down your family member or your child. Part 2 was about signs and symptoms of child abuse, what to look for, and how to approach and how to address this issue. On Part 3, we're going to go over from a physician's perspective. So without further ado, I'd like to introduce Part 3. Part 3 is called Child Safety, Operation Child Safety Part 3 from a physician's perspective. And my expert today is Dr. Villanueva. At this point, I will be calling and referencing Dr. Villanueva as Dr. V because she's passionately known as Dr. V with her colleagues, her peers, as well as her patients. Dr. V, welcome to the X Dr. Tommy O Show.
Thank you so much, Obi. It's my pleasure to be here.
Yes, from this point, she'll be calling me OB because that's how I am known with my patients as well as my colleagues. So, OB. Well, would you address our community and just, who you are, where'd you come from, your training?
Okay. Well, I'm a real Bronxite. I was born and raised in the Bronx and did all of my training in the Bronx. I went to all the public schools here in the Bronx, attended Walton High School, went to Oshkosh Community College, and then to Lehman College, and from there I went to the Albert Einstein College of Medicine, also in the Bronx, and trained in the residency program at Montefiore Residency Program for Social Medicine, which of course we all know is also in the Bronx. So I'm a real Bronx person.
Bronxite.
Yeah.
I was born and raised and educated here in the Bronx. I like to make it one point, and like I said, being an expert in adolescence and pediatrics and with child abuse and child safety, I've been involved in medicine for the past 16 years. I started my training in 1990, and I can emphatically say there is no one that I know that is more proactive, more involved in the community than Dr. V. Before we get into some of the topics or questions, why you decided to do you got your master's in social health and
public health.
Public safety, public health. Why did you choose that? Versus just I'm going to be a general pediatrician. Does something draw you towards that?
Yeah, absolutely. When I decided to become a doctor, I had a really hard time as a youngster and was told at a very young age that I wasn't smart enough, that I'd never make it, and I kind of got detoured and went to work instead of going back to school. And so I got married, had 3 kids, and then after the marriage was a little rocky, I decided I better go back to school and do something for myself because I knew I needed to provide for my children. So I went to medical school after my children were born. So I had 3 kids, and my passion, of course, has always been children. Started as a mother first before I became a physician. And I always was interested in providing services for the underprivileged and the uninsured because that's my background. That's where I came from. We came from a family where we didn't have a lot. There were 7 of us, and it was difficult for us sometimes. And so I comprehend what it's like to be able to raise a family with little or no resources. And so I wanted to give back. And that's exactly why I'm so interested in public health and went back for my master's in public health at Harvard to be able to provide that kind of service here to our community.
Right. So you're taking like negative experiences and turning them more into positive.
I'm trying.
Yeah, and you're enriching your community. Because I know we work together, and I see, you're touching not just the children, the pediatrician, the pediatric patients. You're also making a difference with the family because here we're having a lot of children having children, and
Yes.
I see you're practicing because it's adolescence. Because if you're 16, you're having a child. Yes, you consider an adult, but really you have
You're
the mindset.
still an adolescent.
Yeah, exactly. So you're also, again, you're nurturing as a mother. Those skills are coming out, and so you're embracing your patients. So you're not just, again, a physician, you're also a mother as well.
Yes, it's true. And you can't not be who you are. And so because I came to this profession as a mother first, that always comes through. And I relate to parents and I relate to children. I see the kids as if they were mine. And I relate to parents by saying, what if I were in that position, which I was in the past, or in a lot of those positions. So I understand, and I try to do my best to provide those kind of services. And that's where my passion comes from.
And you can see it, because I know, because we're only one door away, and we hear the conversations, and actually we communicate a lot. And part of what we call continuity care is that communication. We have oral, written, and we communicate both verbally, and if we're not sure, we'll ask each other questions about medications or the appropriate care, and we're always, we interact and we cross-reference, and it's very important, it's vital. We want to provide the best care.
Best services.
Now, I'd like to, talking about child abuse, the first question would be is, how would you recognize injuries if they're intentional or accidental?
Okay, that's a very good question because children are always getting hurt. They're falling, they're getting bruised, they get broken bones, and when a parent sees that a child is hurt, a lot of times they'll get afraid to come forward to get medical care because they're afraid, well, they'll call ACS because the kid has a bruise or a burn or has a broken bone. But as you know, as a trained physician, there are ways that we can tell. And for instance, if we see bruises where we expect to see them on the shins, on the arms, places where kids are bumping into things, we say, well, that's probably going to be something that's